Thank you, Dr. Manish. Good evening, good afternoon, and good morning. This is the 1290th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Neha Kakkar from Uttar Pradesh. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, that International Forum for Promoting Homeopathy is doing a lot of work in the field of webinars to promote homeopathy among doctors as well as students and among public. And we have 3 sessions in a row. That is from 7 to 8, we have our Hindi session. 8 to 9, we have the international session in English. And from 9 to 10, we have a local language session in Malayalam. As you all know, today our guest is Dr. Neha Kakkar from Uttar Pradesh. She has completed her B.H.M.S from Delhi, and after that she is doing excellent practice for the last 16 years and is having her own clinic, and it is known as Homeo Cure and Care Clinic, Meerut, Uttar Pradesh. And she is a member of Meerut Homeopathic Medical Association, Red Cross Society Meerut, and South Delhi Homeopathic Association. She has presented various papers of different subject and a topic of cancer and its homeopathic etiology and management at All India Homeopathic Congress held at Hayat Center at Delhi in 2023. That means just some 4 months back, she had a wonderful presentation at Delhi, and she has written a lot of articles, and it was published. 2 articles were published at Homeopathy at 360 website. The first one is Homeopathy, a nanoscience, and the second is a case of blackish discoloration of the skin along with H.M.S patches cured with Natrum muriaticum. And today, she will be talking about ADHD and its homeopathic management. Earlier, she had a wonderful presentation some 1 month back here in this forum. Let us welcome our beloved guest, Dr. Neha Kakkar, to this session. She is one among the moderators of IFPH, and she is in a big way giving support to the International Forum by attending all sessions as well as doing moderation at our Hindi as well as in the Hindi session. Welcome, Dr. Neha Kakkar.
Thank you so much, Dr. Dinesh, sir, for a wonderful introduction and for all the gratitude you are providing me, or the love and support you all are providing me. It's been a pleasurable journey for me since the last 2 months I have joined the IFPH, and I would again like to thank International Forum for Promoting Homeopathy for providing me the opportunity to present my presentation. So I'm sharing my screen.
Yes.
I hope everybody can see my screen.
Yes, it's visible. Everything's fine. You can go ahead.
Okay. So the topic for today's presentation is a burning topic of a mental health condition whose incidence and prevalence has increased manyfold in the past 2 or 3 decades, and it is growing at an epidemic rate in the society, and it's a matter of concern for us as an individual, as a family unit, and as a society, because the cases of ADHD are increasing 2-folds and 3-folds day by day. So the topic is ADHD and its homeopathic management. Now, what exactly is ADHD? The full form of ADHD is attention deficit hyperactivity disorder. Now, how it's been increasing in the past decades? What are the statistics which show that its incidence is increasing in the past 10 to 20 years? Now, according to the National Institute of Health, United States, sorry, The past 10 to 20 last couple of decades have seen a continuous increase in the ADHD diagnosis, and it shows an increase of 66.1% to 10.2% in the 20-year period from 1997. Here you can see the incidence of ADHD in the primary school children as shown in the chart. From around 100% of the children, 11.33. Now that's quite a percentage. So this much percentage of children are seen to have symptoms of ADHD. Another statistic, this is a therapeutic market executive report, which shows the growing budget that is allotted for the drugs which are used in treatment of ADHD. The ADHD therapeutics market size is at around 538 millions in 2022 and is projected to reach $1,195 million in 2030, exhibiting a growth rate of 10.5% during the forecast period. So you can see within a 10 period time, it is the medicine statistic is almost getting, doubled and more than double. And the Ministry of Health and Family Welfare received $10.79 billion from the union budget in the year 23-24, a rise of almost 3.4% from 10.43 billion in dollars in the financial year of 22-23. So these statistics are clearly showing that the incidence of ADHD, that is attention deficit hyperactivity disorder, has increased, and also the market size of the drugs that are used in the treatment of ADHD. Now, what are exactly the main signs and symptoms of ADHD? Now, as the name itself suggests, ADHD is attention deficit hyperactivity disorder. The child, and this, this incidence of ADHD is mainly found in, the age group of 3 to 4 years of children to, up to the age they are entering the teenage, and also entering into the young adolescent and young adulthood period. So you can find a large age group of children and young adults suffering from this condition with only one of the symptoms or with many of the other symptoms. So what are the main symptoms with which we can identify that what ADHD is? The primary symptom which we see in children or young adults who are suffering from ADHD is lack of focus, difficulty in concentrating on a particular task or core. That means the child or the young adolescent cannot, concentrate his attention to a particular task. For example, this task can be as simple as, brushing your own teeth, or buttoning or opening your shirt's button, or even, tying the shoelaces, or just a simple reading task like reading 2-3 sentences, or reading up one page of the book, or writing A, B, C, D, or, simple words. So this is the basic thing which we see, that the brain is lacking the concentration, the attention, or the focus to perform a particular task. Next symptom that we see in children or adolescents with ADHD is restlessness or frigidity or inability to keep still. These kids with ADHD are most of the time just jumping here and there, or they are in constant motion, or either their leg is moving, their hands are moving, or they are in some sort of useless activity that is going inside their heads also, and you can see them visibly doing that. Also, this restlessness is showed, in today's times, this restlessness is mainly showed whenever a child is seeing a mobile. He is just, scrolling down the videos or the reels or whatever you can say, and the brain is in constant, motion. It is not keeping still. So the body and the mind are not at still. They are not at rest. So this constant restlessness or frigidity is also visible. to the outside. They are, engaged in some useless activity all the time. They are just jumping here or there, or, just breaking things around, just, making the room dirty and messy. And they are not able to, consolidate it. Their energy is very restless. So this is the basic second symptom which we see in a ADHD patient. Third is impulsiveness, aggressiveness, or erratic behavior along with anxiety and mood swings. Now, the patients with ADHD are very aggressive in nature. Aggressive means they get angry very easily, they get irritable very easily. Whenever you say something to them, or you tell something to do some things, or to follow some instructions, they react in a very aggressive manner or an impulsive manner. They'll say, no, I won't do that. No, mujhe nahi karna hai. Oh, aap to yahi kehte rehte ho, main ja raha hu. So these kind of answer you say, and there are also answers where they can start abusing also. They'll, abuse the parent, they'll abuse the teacher, they'll abuse their friends and, their siblings, because their mind is not at rest and they are very aggressive. There is impulsiveness inside their brain. So they will react in such types. And the other side of this can also be that the person is not reacting at all. There can be another side to it also. I'm not mentioned here in the slide, but sometimes the ADHD patient might show a completely opposite picture also. He may not respond at all. If you're asking some question or giving some instruction, he will just keep quiet and just stare at you. He will not respond at all. So this is the other side which we see also in ADHD patient, both aggressive side and hyperactivity also, and hypoactivity of the brain. Fourth symptom which we see in ADHD is forgetfulness with short attention span and absent-mindedness. The person, as the young adult or the child, cannot concentrate on a particular thing. He cannot concentrate on the blackboard. He cannot concentrate what the teacher is saying in the classroom. He cannot concentrate what the parents are telling him, that what is good for him and what is not. So he is not able to fix his attention to all the instruction and all the set of rules which are being laid down. And also his brain is in constant motion. The brain cells are, discharging all the erratic signals in him just to do, useless and frivolous things. So this leads to increased forgetfulness with a short attention span and absent-mindedness. They might, forget doing things. They might forget what that they have to do their homework. They have to, submit some project in the school. They have to do some other important work, or they have to, even they might forget brushing their teeth, or they might forget taking a bath. So these are the common things which we encounter in these patients. So these four symptoms are the basic picture which we see in an ADHD patient. And here you can see this short attention span, careless mistakes, fidgeting, act without thinking, forgetfulness. So we see a myriad of symptoms. We see a variety of symptoms which are coming, and mainly resulting from the hyperactivity of the brain and lack of focus. So we see both type of pictures. We see an hyperactivity picture also, and sometimes we see the opposite side also, that is hyperactive. The child might also go in a depressive mode. He might not react to any situation. He might sit all day in a corner and just think and daydream, and not pay attention to his room or his work, his school work, his surroundings, and he goes into a shell also. So this is the other side of ADHD that we also come across to see. Now, how can ADHD in childhood, and how these symptoms are shown in childhood, and how the same symptoms are converted in adulthood? Where here you can see in the table, we have a school failure or underachievement because of the forgetfulness, because of the hyperactivity of the brain, because of lack of attention, because of the erratic and impulsive behavior. The scholastic or the academic activity of the child suffers a lot, and he becomes a school failure or an underachiever, and which in adulthood shows as a job failure or underemployment. He might not getting up a job because of this, all the symptoms he's experiencing. The second symptom is like, because he is, hyperactive and jumping always, or, having this frivolous behavior, he might have multiple injuries also, which becomes accidents or car wrecks or risk-taking behavior. This is shown in the adulthood. Now you can see how slowly the symptoms which are coming in the childhood, how they are being converting into very big issues when they are reaching their adulthood. These individuals are facing, they'll just start showing some symptoms, and slowly, if we ignore or we cannot identify the symptoms in the children or in the young adolescents, they slowly, become to these life, life changing, or life decreases the quality of their life. Because if you don't have a job, or if you are having multiple accidents, or you're having other things, then obviously your life becomes hell. Now there is a lot of drug experimentation in these kids also, because they also suffer from low self-esteem. Now if you constantly tell a person that you don't know, because these children are not able to perform good even in school or in sports or other co-curricular activities also, and at home also they are a nuisance to everybody. So everybody starts telling them that you are a useless child, you don't know how to do things, you cannot do anything like. So resulting in that, the child suffers from a very low self-esteem, and that can lead to drug experimentation at a very young age. Like in our society, and also around us, we see that children are experimenting very early with alcohol, with smoking, and even drugs. So this picture thing comes into play, and which leads to drug dependence in the adulthood. There is oppositional defiant disorder or conduct disorder. The behavior is very much erratic. They don't want to mingle up with society, they just want to stay aloof, or they just mingle around with people who they think are right, but then those people might not be right according to their parents or their friends. And they become criminally involved, and they develop an antisocial personality disorder also. So we can see slowly how things are getting evolved. Due to repetitive failure becomes hopelessness, frustration, and resignation. And these are the children or young adults which might also commit suicides, because the person becomes so hopeless with himself or herself that I am not worthy, I am of no use, I am not productive to the society or to the family or to anybody. So they become so depressed and so into themselves that they feel like that ending the life is only the option left. So these all things come into picture when we see a ADHD person in childhood and in adulthood also. Now, what are the probable causes which can lead to this development of attention deficit hyperactivity disorder? As I have said previously in the presentation also, that this incidence of ADHD has increased manifold in only in the past 2 or 3 or 4 decades. So what is exactly happening around us, or what is exactly happening in the society, which is leading to the development of ADHD? So we come across some factors, and I have just dotted down some common factors which are commonly, seen in considered by the medical fraternity, and also some factors which I feel can be the cause for the development of ADHD in today's times. So the first cause being brain trauma. Brain trauma, as in, if a child is suffering from injury in the intrauterine life, that is when the child is within the womb of the mother, or child has suffered any injury outside the womb of the mother when he has born. He's 2, 2, 3, or 1 year of age, and he has suffered some injury. So the brain cells get damaged, and they don't they get damaged, and the proper functioning of brain cells is not there. So this things comes into action, that slowly the child develops the symptoms of ADHD. The second factor which we see is a genetic history of ADHD or depression or anxiety. Whenever there is a history of depression, anxiety, or any mental health disorder like bipolar disorder, or ADHD, or maybe some, some kind of a brain trouble where the functioning of the brain is not proper, either of the parents or of the grandparents or any of the relatives which are surrounding. So this things get transferred into the genes of the child, and he might start developing the symptoms of ADHD. Third symptom that we come across, and it's a very common thing that is occurring nowadays, is smoking and alcohol intake history by the mother during the pregnancy. The mother, today as we are moving towards a cosmopolitan world, and the society is getting urbanized, so it's considered very normal also for a female to take smoking and take alcohol into their daily routines. So, but now this is a proven fact that alcohol and smoking can damage the brain cells and other organ functions of the baby which is inside the womb. So slowly, these things starts hampering the brain or the mental health also, and ADHD starts coming into the picture. Premature birth or a decreased brain size. Now it is sometimes it is seen that some children who are born prematurely, or they are born underweight, or they have a decreased brain, head size, where their proper development is not taking place, or the children who have open fontanelle cell birth, these children tend to have, decreased brain size levels. So this can also lead to development of ADHD symptoms. Environmental toxins, side effects of vaccinations and allopathic drugs. Now, the modern medical science has, advanced very much, but Dr. Hahnemann had a different perspective of things. He left allopathy practice and came and found homeopathy, and he found out the presence of microorganisms also long before they were discovered. So he was I would say he was a forecaster, or a person, or an intuitive person, or a forecaster person who saw the future. He saw that in future we will have some system which will be based on viruses, bacteria, and drugs which will be attacking the physical body and the mental body. And so in his organon he has laid down all the principles which are identifying the side effects and the negative effects of the allopathic drugs and also of the vaccinations. Now, vaccination is a topic which is very much debatable. Vaccination is very much needed because they tend to remove the deadly diseases like polio and chickenpox and smallpox. But what we do not know, that these vaccinations are also causing a lot of damage to us, and especially the over vaccination that is happening nowadays. The allopathic practitioner makes a full card of the child, and which comes to his clinic, that you have to get vaccinated for the influenza, you have to get vaccinated for the this virus which is causing loose stools and other multiple vaccination. Previously there were 2 or 3 basic vaccinations which were given, but now the list goes on. It is the endless list, and it is causing damage, and it is very much visible, and at least the homeopaths know this thing and they can see this thing. Now, this is a very important point, the concept of urbanization. As our society is moving from being a close-knit, value-based system of family, that is joint family, to a self-individualized and self-centered nuclear family setting. I'm not against nuclear family, or not I'm a very much very much promoter of a joint family. But the thing is that previously, when there was a joint family system, or a system where the families used to stay together, big families used to stay together, there were many siblings, there were many uncles and aunts and nieces and everything. So that provided a very positive environment for the brain development of the child, because the child is getting love from the parents, from the grandparents also, from the parents also, from the aunts also, from the uncles also, from the niece, and he learns to adjust, and he learns to see things also in a different perspective. I'm not saying that joint family system does not have any negative points, but the basic concept here I want to make clear is that uh, the love and the emotional need that was being fulfilled for a child, that is not getting fulfilled in a nuclear family setup. Now, in a nuclear family setup and in today's modern world, both the parents are working, the father is also working, the mother is also working, and they don't have enough time to give to the child. They don't have the time to listen to the child, to their needs. Their small things like whatever the achievements they are taking, they don't have the time to listen to the child and to tend to his emotional needs also. And the parents are only the thing who are teaching also, they are working also, and they are the only support system. And whenever the child does not get the required emotional or intellectual support from the parents, it tend to go into some other patterns of thinking, and that is reflected in ADHD very much. And I think this point is very much a major factor for the development of ADHD in today's population. The last factor, but not the least, that is as I mentioned before also, unfavorable emotional intellectual environment at home or a school. There is a constant pressure on the kids nowadays to perform, scholastically and academically also, and co-curricular wise also. They have to, fair get A grades in everything, A plus in everything, and they need to perform to the highest level of things. So this causes a excessive pressure on the brain of the child, which can also lead to withdrawal symptoms and also hyperactive symptoms, as we see in the symptoms of ADHD. So these are the basic causes which we see, factors which can lead to development of ADHD in children and young adults. So now here I want to mention something. I don't know whether how much this is correct, but there seems to be a correlation between ADHD and autism, because there are many symptoms. Here we can see symptoms like sensory issues, impulse control difficulties, emotional regulational, higher rates of substance abuse, suicidal, depression, anxiety, OCD, no communication patterns, executive functional difficulties. So here we can see a set of symptoms which are very much common in autism and ADHD, and sometimes these two diseases seem to overlap, because we can say that ADHD can act as a precursor for the development of autism. Obviously, autism is a next level brain damage or brain cell damage disease, because the person is not able to perform very simple activities also, like just taking their food to the mouth, or even having this consciousness of his surroundings, and even eating food. These things are not seen in ADHD, but in autism there is a next level things, and the children with autism cannot attend a normal school. They need a special school for their special needs. But the things which we see in autism might and should have a base in ADHD. And so we need to stop the disease at the beginning also. At the time, the most important thing we need to see is that we need to identify that the child is in a problem, and it's not shameful to address the situation, and we need to stop it right there at ADHD so that it doesn't convert into an autistic trait. So these are the things which we see both in ADHD and autism. Now, what is the treatment which is done for ADHD? The approach for treating ADHD includes medication along with behavioral therapies. The medications which are used by the modern medical systems are some stimulants by the name of methylphenidate and amphetamine, which have a calming effect on the hyperactive brain with ADHD. These are thought to increase brain levels of dopamine, a neurotransmitter associated with motivation, attention, and movement. So these drugs, you have a calming effect on the brain, and they decrease the hyperactivity level in these children. Then we have some non-stimulants like Stratera, that has atomoxetine, Intuniv as guanfacine, clonidine, and these are the names of the drugs which are used in treatment of ADHD, viloxazine. We are not going to into the details. So these are the basic drugs which are used by the modern medical science. And along with the medication, we have an important part played by the therapies, which are the different therapies which are used for ADHD. Now, as we see, there is a lot of emotional baggage and a lot of things which are going inside the head of the patient. He's, confused. He is with slow self-esteem. He is with depression. He is with anxiety. He is not behaving normally. He's not performing good in the school, not in the co-curricular activity. So a lot of things are going inside the brain. So to vent out these emotion and thoughts of the person, we need these therapies, which are cognitive behavior therapy, where we counsel the patient that this is a disease and we need to take care of it, and you don't need to feel so low about it, and you don't need to feel so depressed about it. So these things are done in the therapy sessions, and we can have anger management therapies, counseling psychology, psychoeducation, and family therapy, where we can counsel the patient and also the family about the various symptoms which we see in ADHD, where we can take a group counseling session with the family also, and with the other people also, where we can explain that this is a problem and we need to address it, and slowly we will take into account of the different things to drugs also and with therapies. And everybody needs to understand that this child or the young adolescent needs help, and we need to handle it with love and care, not with anger, and by just hitting the stick. We need to handle it lovingly and with concern and care. So these therapies are very much an important ingredient of the treatment which we do in ADHD along with the medications. Now, coming to the homeopathic management of ADHD. Homeopathy, as we know, can cover a myriad of symptoms, of mental symptoms, which we see patients of ADHD. And these are some of the common homeopathic medicines which we give in ADHD. We have agaricus, anacardium, arsenic alb, baryta carb, calcarea fos, carcinosin, cinna, and thuja. And we also have hyoscyamus, medurinum, natrimur, lycopodium, naxomica, stramonium, tarantula, and tuberculinum. Now, obviously, there can be many drugs apart from this, because we need to individualize and take the proper case, and we have to find the constitutional drug that is matching with the picture, because every case of ADHD will have a different picture presentation. They might have a hyperactive presentation, they might have a hypoactive presentation, they might have a depressive presentation, they have an anxiety based presentation, they have they might have a other presentation where the child is looking just normal, but he is suffering scholastically. So we have a variety of picture presentation, and according to that, we need to take the case and select the medicine. So you can have these medicines or other homeopathic medicines also. And these are the common rubrics which we can be taken into consideration while taking a case of ADHD. I have kept Robin Murphy's Homeopathic Medical Repertory, 3rd edition, as my reference. And these are the common rubrics which we can take from the mind chapter, which are hyperactivity, learning disabilities, impatience behavior, absent-mindedness, forgetfulness, anger, answers, aversion to, anxiety, biting behavior, changeable behavior, concentration difficult, contemptuous. So these are the rubrics which we can find in the mind chapter in this repertory. And we have a separate chapter on children by Dr. Robin Murphy, and this is a wonderful, and I would suggest and recommend every homeopath to read this Robin Murphy's repertory, because it is including all the modern day terminologies, modern day causation modalities, and modern day diseases and symptoms which we come across. The old repertories of Dr. Kent and Dr. Boning Hassan and Dr. Hahnemann's chronic diseases. Obviously, these are the base books, and they are the base books which form the base of the repertory. But repertories like Dr. Robin Murphy's repertory are providing a new and modern perspective to the different rubrics and different symptoms which we come across diseases like ADHD, because ADHD was not a disease which was found in, Dr. Henman's time. It is the disease which is being found out today. And we have many new symptoms which are coming up. So he has inculcated many new symptoms, and there's a different chapter on children where we have rubrics like anxiousness, concentration difficult children, dwarfish children, learning disabilities, hyperactive children, screaming, dyslexia. We have the term dyslexia also in clinical chapter. And we have a different chapter on toxicity, which has toxicity due to chemical pollutants, toxicity due to antibiotics, toxicity due to ailments from drugs, toxicity of tobacco, vaccinations, reactions, ailments from autism, children vaccination after. So we can see that vaccination is causing autism indirectly, not directly, but indirectly. So these are the different rubrics which we can see from Dr. Robbins Murphy's repertory. And the miasmatic analysis of ADHD has mainly two miasms, which is the psychotic miasm, which includes symptoms like brooding, difficulty in attention, and forgetfulness, daydreaming, planning, plotting, repeated thoughts and action, anxiety, depression, frigidity. So these are the psychotic symptoms which we see in ADHD. And the syphilitic symptoms obviously are like jealousy, destructiveness, aggressive behavior, disobedience, suicidal and homicidal tendencies. So mainly I think psychotic and syphilitic miasms are adding. This is my interpretation. Obviously, anybody can have, SORA also included. I'm not saying that, but this is my interpretation of the miasmatic analysis of ADHD. Now, coming to a case which I had in my clinic of ADHD, and this was my third case of ADHD. Previously, before that, I had treated two more cases, and this patient came to me with the reference of the previous ADHD case I had treated. So the mothers were, friends with each other. So, and the presentation of the previous ADHD child was very much different from this patient. The previous patient which I had a more subtle presentation. He was, more withdrawn child with, depressive and daydreaming like episode. But this patient had a more hyperactive presentation. So here you can see, I chose to present this case because I didn't have much time to prepare my presentation. So I only took one case. I can present more cases in the upcoming sessions. Now, this patient was an 11-year-old male child, which presented on 5th January 2023. He had decreased concentration in studies. His mother's main complaint what? कि वो पढ़ाई नहीं कर पाता है. उसको पढ़ाने बैठाओ तो वो भाग जाता है, बार बार उठ के भाग जाता है. मैं उसको बार बार बुलाती हूँ, वो फिर भाग जाता है. 2 लाइन पढ़ता है, फिर उसके बाद उसको भूख लगती है, या फिर उसको ये लगता है मम्मा मेरे को सुसु जाना है. Then I have to go there, I have to watch this thing, I have to do this thing. He is not just sitting there. He just reads for 15 minutes or 20 minutes, studies there, listen to his mother, and also in that period, his mother is constantly shouting on him. So he's not concentrating, he's not able to fix his attention. Hyperactive behavior, the child could not sit still while eating or studying. जब वो खाना भी खा रहा होता था, तो तब भी उसको भागना होता था. उसने 2 गिलास खाए, he ate 2 morsels and then he ran away to watch the TV, or he ran away to, just jump around or dance around. He would run every now and then, and the mother was very much irritated because, even while eating, he was not sitting still. He was just eating and just running around. Then he eating 1 morsel or 2 morsel and just running around. Was very self-willed, did not obey his parents. बहुत जिद्दी जिसे कहते हैं ना. He was very, very obstinate. उसको बात नहीं माननी होती most of the time. मम्मा ने अगर उसको कुछ बोला keep your things properly, keep your books properly, so he would not obey the instruction. He was hyperactive behavior and danced frivolously. He was always, most of the time doing all the silly things, not exactly dance, but his mother, mother was telling that he was do silly things. He was just make faces like this, or, just make like this, all the silly faces he used to make, and he used to jump around and something dance around, he's with this back moving and all the other things, all the silly behavior he used to do. And the teachers also complained that in class he had reduced attention and engaged in quarrels with his co-students quite often. So this was the basic picture where we see his brain was in hyperactivity. He was not able to focus in his studies, and obviously his irritability level and anger level was also high because he used to engage in quarrels. The child was a hyperactive child since childhood, but the complaint of decreased concentrations has increased recently. Previously, he was a good student in nursery and in first class and in second class. Currently, he was in fourth standard. But in first and second class, he was a good student and used to get good marks. And he was an hyperactive, right? He was a frivolous child. He used to jump and do, but he was good in studies. But recently, his concentration has decreased, and this behavior had started coming up. Had screen time of more than 3 hours a day. Now here you can see this thing I forgot to mention in the causative thing, because I'm running, I'm having this time constraint period in my mind, that the usage of, social media and mobile watching and excessive TV watching, that is also due to the inability of the parents to pay attention to the children. So they engage in more of screen time and mobile watching. They don't play games, but they watch mobile all the time and they watch TV all the time. So this has led to, he had in screen time for more than 3 hours a day. He was watching mobile all the time. So this was there in this thing. And so this, I guess, affected his brain levels activity very much. He suffered, past had suffered from right side inguinal hernia, got operated, had random attacks of bronchitis when exposed to excessive cold. He had repeated attacks of bronchitis. Family history, his father also had inguinal hernia since last 10 years, but also got operated only 2 years back. So this inguinal hernia was there in the father and also in the son who was getting treatment from me. Mother had hypertension and had gestational diabetes. Okay. He was a fussy eater, and we see in the dietary category, he was a very fussy eater. उसको खाना पसंद नहीं था, उसको सिर्फ चटपटी चीजें चाहिए होती थी. He used not to eat the vegetables and fruits. Very fussy eater. And in the physical generals, we saw bronchitis, obviously attacked him later, susceptible to cold. He was a very chilly patient. ठंड बहुत लगती थी उसको. He was chilly patient in 3+, lean and thin, emaciated, pigeon chest, has dark circles around the eyes. Appetite good, can't tolerate hunger. He used not to eat, but whenever he used to feel hungry, he was like, "Mama, मुझे अभी दो खाना, मुझे अभी दो." तो उसको बहुत जल्दी भूख लगती थी. एक तो बार-बार भूख लगती थी, हर थोड़ी देर बाद मांगता था खाना. लेकिन but he used to eat only few things, and the things which he used to like, not what his mother used to say, you eat a fruit or you eat something healthy. He used to eat all the namkeens and chips and all those things. So desire was of spicy and salty, aversion to milk and green leafy vegetables, urine normal, stool satisfactory, sleep sound sleep, but startles in sleep. He used to startle in sleep. He used to get frightened like this in the sleep. He used to startle like this in the sleep. Sees frequent ghost in the dreams. Perspiration is normal. Tongue clean and moist. So the sleep and the dream pattern was significant in this case. Coming to the mental generals, he was restless. He used to curse and swear also. He used to, say, "Mama, I swear. Mama, I do this. Mama, I swear I'll do this." But he again used to do the same things. Fear of being alone, especially at night, vexed on trifles. At small thing, he used to get angry and used to make faces like this. "Mama, I'm very angry. I will not talk to you." So this was the thing. Now, these things I inferred from the mother, and I also came to notice in the clinic. Whenever I used to interact with him, these things were seen. Cannot be a contradiction. Gets violent when angry. Obviously, it's visible in the school area where he's quarreling with everybody. Consolation aggravated. Weeping disposition, self-willed, but emotional by nature. He was very emotional and very much attached to his mother. He was not obeying child. He was obstinate. He was hyperactive. He was frivolous, but he was very much attached to his mother. General survey, scar. So the clinical diagnosis of ADHD was given by me. And here we see the repertory sheet. So we have different medicines here. We have Naxvomica, we have Lycopodium, we have Stramonium, we have Natromure, we have a variety of medicines. But after seeing the case, the remedy that was coming to my mind was Stramonium. So this is the follow-up of the case. I chose Stramonium for him because of the quarreling nature and the hyperactive nature and the shouting nature. He used to shout also on his mother. So these, hyperactive and dancing behavior. Obviously, other medicines were also coming in, and because of the aggressive behaviorness and anger, I chose stramonium for him, and I prescribed stramonium 1 mg for him, followed by placebo for 3 weeks. No improvement of symptoms on the first follow-up. Again, stramonium 1 mg was repeated, followed by placebo. Then on the second follow-up, there was decrease in the physical restlessness, mentally improvement in aggressiveness. So aggressiveness came down after stramonium. He was less aggressive. His mother told that he has started obeying me, and he is less aggressive in his nature. He is less angry. He's less irritable. So I prescribe rubrum metallicum or saccharum lactis, or whatever saclac which we say, for 1 month again. But there was no further improvement of symptoms. Stramonium 1 mg repeated OD dose per week, followed by placebo for 3 weeks. Again, no further improvement of symptoms on the fourth follow-up. So I again analyzed the case. I again took up the case, and then found that natrum muriaticum was coming up because of the emotional plane of the patient. The child was very emotional, was very much attached to his mother, and obviously the symptoms of sulking and getting irritable, this anger, desire for salty food, obviously they were there previously also, but sometimes we just cannot see, we see the outer picture of the patient. We see only the hyperactivity, we only saw the anger, we only saw the irritability, we only saw the aggressive behavior. But what we did not see was that the child was feeling emotionally vulnerable. He was very much attached, and he was not getting the attention he wanted from his mother because his mother was working. So that also fueled for the development of ADHD symptom in this patient. So I chose natrum muriaticum, which I gave in 1 mg potency, followed by placebo. Child became very much calmer mentally on the fifth follow-up. His focus in studies improved. Physical restlessness was also less. Overall improvement in symptoms, 30 to 40% symptoms were improved. He started concentrating, restlessness less, focus in studies also improved. Saclac given for 1 month after that. No further improvement of symptoms on sixth follow-up. Nitramur 10 mg was prescribed. I gave Nitramur 10 mg just to give a push, and OD dose followed by placebo. More improvement in concentration in studies. Child pains more happy and content, is less frivolous, better at concentration and focus while performing all activities. So there was marked improvement just in 2 doses, from 1 mg and 10 mg. Placebo again given for 1 month, and the patient was 70 to 80% better. He improved a lot, and that was visible on his face. His picture changed in front of me. I did not have the picture of the patient because this was not a case where you can take the picture. In skin cases and other cases where we can take pictures easily, so I did not take a picture, otherwise I have showed. There was marked improvement. The dark circles went away. He was more happy, he was more content, and he was more focused. He was not restless, he was not jumping, he was focused in himself, he was centered in himself. So this was the case, and I conclude my presentation by saying that homeopathy along with behavioral therapies can effectively manage and cure cases of ADHD. So if we combine homeopathy along with the therapies, obviously this behavioral therapy thing is very much needed in ADHD cases, because previously also I mentioned that there is a lot of emotional baggage that is being carried out with these children and young adolescents, and there's a lot of जिसे कहते हैं ना उथल पुथल चल रही होती है इनके दिमागों में, जिसको बाहर निकालना बहुत जरूरी होती है. So the behavioral therapy is very much needed, and even if the patient cannot separately go for a behavioral therapy, the homeopathic doctor can prove to be a psychologist very well, and they can provide the necessary therapy, they can provide the necessary counseling along with their homeopathic medicines. And I also did exactly in this case. I counseled the mother, to change her behavior toward the child, to be more subtle, to be more calm, to encourage the child more, just not always, because the mother was working, he was used to always more of scolding was there instead of the loving and the caring and the nurturing nature. So I counseled the mother, and that also pushed the patient to improve, the child to improve along with the homeopathic medicine. So this is what is about this case and about ADHD. And thank you, everyone.
Thank you, Dr. Neha Kakkar. It's really a wonderful session. You have shown the beauty of homeopathy with the case single, even though the single case you presented here. But the more important that there are many people who have presented about ADHD in this present in these webinars. But this is really an entirely different session with that I must say a thrilling session from you. As homeopaths used to get these kind of patients in the early part of our practice. That means some about 35 years back. But in those days, we were never looking at the ADHD or a
Yes,
Down syndrome or like autism like that. But nowadays, things have changed a lot.
yes,
And even we people used to differentiate what is what, and we used to treat the patient, whether it is ADHD or the autistic or Down syndrome. What are all these patients are somewhat similar, but you will have to differentiate what are the real cause behind the illness. And of course, there are many reasons, but most important reason what I have noted is the atmosphere of the child, the reason the things that happens during the pregnancy or before the pregnancy and after the delivery. All these things all these three things combined together to form an autistic child. And once the child come out of the womb of the mother, things will the child may start reacting to the situations. But at the time in the early part of the career, the child in the people we may think that it is nothing disease part, but there are the child may be showing those symptoms from the very beginning. And as you rightly point out, the vaccination play an important role because as all of us know that the vaccination started at the 45 from the very birth itself, and then again on the third, 40th, third month, like so and so, lot of vaccination, over medication, I must say.
yes,
They are mixing lot of medicine together and keep pumping it into the body of a child who has a lot of only very little to do with that. They are losing their normal resistance.
yes,
That may
yes,
also an impact because we have seen a lot of patients who have developed such symptoms after taking vaccination. But usually when the patient report that such thing happens to their the doctors at the other side, that is allopathy, they may say that it is not because of that, it is a kind of new disease like that.
yes, yes,
We will take the MRI and see, and they will show that, oh, your child having this disease. I have seen a case because very recently, a child was having this problem, and she was brought to my clinic, and after taking case, I found that when I asked her, when did these symptoms happen, she showed that the doctor, everything happened after the vaccination. At the age of 1.5, up to that time, she
yes,
was very, very healthy. She used to play, she used to communicate, she used to dance and everything. But after that, then I asked whether you reported. They say, yes, doctor, we have reported. But they told that it is not that because of vaccination. But later, one night, the child died
yeah,
after. But because they were staying not in my area, but some 45 kilometers away from my home. But because the mother was married to such a place, and where they consulted the allopathic doctors, and they told that it is not it has anything to do with
our
this
medicine, yeah.
vaccination. This is what happens nowadays also. Lot
Yeah,
of
yeah,
patients,
yeah, Dr. Dinesh, recently also I have a 85-year-old patient who is coming for me, for pancreatitis. He's also taking inhalers for bronchitis, and he had this recurrent hiccups. So he went to a neurological doctor and he prescribed some psychotic brain medicine for his hiccups. He was taking the medicine for hiccups, and he was also consulting me for pancreatitis. So after taking that medicine, within 2 days, he started having hallucinations due to that drug. And when I looked up the drug on the internet, you know, the symptoms of this drug, that same hallucination and psychotic symptom, you know, he used to started, you know, laughing like, you know, like mad people, and उनको पता नहीं क्या क्या दिख रहा था कि वहां पे कोई खड़ा है, ऐसा हो रहा है. तो उनकी जो her daughter, his daughter called me up, and she said this is happening. So I immediately told her to stop the medicine, and I prescribed Nux vomica just to counteract the effect of the medicines. And within 2 days, he was just okay. And I asked the doctor that you should ask the doctor, that the neurological doctor is a very famous doctor here in Meerut, and he was the relative of that person, and he was not admitting that is due to the drug, but
Yes,
obviously it was due to the drug.
exactly. This is what happens nowadays due to people suffers a lot after this vaccination during COVID, and still they are not saying that it is not because of the vaccination, but frankly they are just hiding things away from the people. But even the ICMR has come up with such a statement after their research work that it is not doing any harm. But doctors from other part of the world have shown that they really do a lot of damages. This COVID vaccine has done more good than harm. And this is what I would like to say. Let us go to Dr. Ram Parashar to say few things, and adherents are also there. If anybody want to communicate with Dr. Neha, you can speak now. Please unmute.
Thank you, Dr. Neha Kakkar ji.
Thank you, sir.
Very nice presentation.
Thank you.
ADHD,
Yes.
cause and effect,
Yes, sir.
depression, suppression, drugs,
Yes.
and miasmatic cause. Role of miasmatic cause. ADHD. Very nice. Excellent session.
Thank you, sir.
I am very happy. You are doing presentation in body language. Body language is a strong, beautiful language. तो ठीक है, बहुत बहुत धन्यवाद. और आपका जो इसी तरह से आपका बोलने का जो तरीका है बहुत अच्छा है.
Thank you,
इससे
sir.
हम बहुत प्रसन्न हूँ. और थैंक यू. ओके ओके, वेरी नाइस.
Yes, exactly. There's if anyone want to communicate, please raise. I think Tilari may want to speak. Dr.